Well, good morning, everyone. It's wonderful to be here with all my colleagues, my nursing colleagues and my medical colleagues. As she said, I'm going to give you some insights into what our world, the world we work in, and how that relates to how we build sustainable leadership in our organization, and certainly how you can do that in your own organizations. She just spoke about JPIGO. As she said, we've existed for 40 years. We've worked in more than 150 countries. Right now, I have a staff of 2,100 working in 50 countries. A good 15% of those staff are physicians. A little greater percent of that staff are nurses and midwives, and the rest are public health leaders, finance, management, and the like. Most importantly, the majority of my staff are from the countries in which we work. Our work, as she said, is very focused on sustainability. We focus on building the capacity of countries so they can provide quality family-centered care. We work in all these areas that are listed there for you, but most importantly, as we all know, the health provider, the team of health providers are integral to a strong health system, but they don't just work in one area. So quite often, we spend the majority of our time talking about integration, not only for the betterment of the women and children, but also for the provider. So a lot of our work is around how do you integrate these other sectors, and actually I'll be talking about that in my talk this afternoon, a lot about how you can integrate this in the countries in which we work. But let's talk about the context of our world. The context of the world in which we live today, 1 woman every 2 minutes dies due to pregnancy-related causes, and 99% of all those women are in the developing world. In the world in which we live today, 1 woman every 2 minutes dies of cervical cancer. And right now, in the world in which we live, less than 1% of all women in the world have access to cervical cancer screening. In the world in which we live today, 3,000 women and 1,000 children will be infected each day. Sadly, in sub-Saharan Africa, 60% of all those with HIV/AIDS are women. And in the world in which we live today, 7 million children will die, 3 million of them newborns, which is essentially the size of New York City. So I ask you, when I think about my career, when I think about what I have done, I think about Mahatma Gandhi said, be the change that you want to see in the world. As she said, I'm the president and CEO of a $300 million organization that's now working in 50 countries around the world. But I am first and foremost a nurse. And I have, throughout my career, worked in a variety of positions as an educator, as a pediatric critical care nurse, as a neonatal critical care nurse. But I have always focused on the change that I wanted to see in the world, and that was not having children and women die needlessly. Now, I ask you to look at these photos. All of these photos you should recognize. Hillary Clinton, the former First Lady, Secretary of State, she had the change she wanted to see in the world. She believed women were the drivers for economic development in the world, and therefore we needed to focus on education and health. Indira Gandhi, who focused on making sure the poor were not slighted and making sure they had access to health care. Bill Gates, a philanthropist and someone that has really focused on innovations like vaccines and ensuring that these get out to the people that need them. And of course, being a nurse, Florence Nightingale, someone that really focused on evidence-based practice and said all of us needed to look at and care for those, no matter their economic level, no matter where they live. But now I ask you to look at these photos. These are also leaders in their own right. These are also physicians, nurses, and midwives. All of these individuals are leaders in their country. All of these individuals are trying, with all the challenges they have, to make a change in their healthcare system. Each one of these individuals is trying to be the change they want to be in the world. If you look at yourselves, all of you are trying to provide quality care. All of you are here today because you yourselves are leaders. All of you are here today so that you can learn from others and in turn ensure that healthcare in your countries improves. But let me just set the stage as to why you'll be hearing a great deal about nursing. What we all need to know is that the health workforce in the world, 87% of all health providers in the world are nurses and midwives. Let me repeat that. 87% of all the health workers in the world are nurses and midwives. And we see that much more in the developing world than anywhere else. And so when we focus on strategies to improve child health and to improve women's health, which we see as tied and should not be ever separated, we look at and focus, obviously, on the nurse and the midwife that are quite often alone. It is really important, though, that you understand that quite often in these countries, nurses are building the team. They're kind of the momentum to building this leadership group. They tap into community health workers. They tap into religious leaders. They tap into the physicians that are quite often in the cities, but are the referral point and the only point that they can bring someone that is critically ill. Now, obviously, this is a picture that I think might be hard to see, but I hope you can see it. This is a picture, as I said, we work in a lot of the most challenging countries in the world, politically unstable, economically depressed. These are countries that have limited infrastructure, poor transportation, absent water, absent electricity. At the same time, what we do know is we need to provide care, but giving care in these countries is very challenging, including any type of care at the critical care level. This is actually a woman that's being carried due to postpartum hemorrhage. She is being carried now 6 hours by her family on a stretcher. You see, in Afghanistan, the catchment area is within 6 hours. If you can get from your village to a facility within 6 hours, that is an allowable reach. But you see, what I want to say to you is for all providers, it doesn't matter the geographic location or the specialty area. We have seen examples where leadership is built from within, where they're able to elevate their profession even in the most challenging circumstances. As well, what I want to be able to give you today is examples of providers that are demonstrating leadership, are demonstrating the ability to not only make an impact on health, but also to elevate their own profession and provide leadership to the environment in which they work. It's an important variable, and it's important for us to understand that the circumstances may be different, but there are realities that cross over in all these places. So let's talk about nurses leading. You'll see a lot of examples of nurses. You'll see that I'll also give examples from physicians. Nurses taking the lead, advocating for women. What we know in the world is nurses understand the gaps. They're quite often on the front line for millions and millions of people to access care. They understand the gaps in coverage. They understand the barriers. They understand why a woman is not bringing her child for immunizations. They understand why a woman is not coming in for care herself for cervical cancer. It's really a matter of knowing and understanding that if not a nurse advocating, who will advocate? They understand and sympathize and work through. They understand the burden of accessing care. They understand unequal gender roles. They understand stigma. This is a nurse named Rati, and a woman came in to see her in antenatal care. Her name was Anita. She had 4 small children at home, and she was now pregnant with her 5th. Well, Rati had learned. She had learned from classes about postpartum IUDs, about postpartum family planning. And she thought to herself, this is an important step for this woman if I can help this woman. But what she also knew was the social context of Upper India. She also knew that most women, when they're married, live with their husband's family. And the person that controls their health is the husband's mother. And so she had to figure out a method by which she would work with all of them. So she first asked Anita, how are you feeling? She said, exhausted. I can't believe I have to, it's hard to be pregnant again, but I have no choice. She brought the mother in, she brought the husband in, and she talked to them about how important child spacing was, not only for the woman's health, but for the child health. Now, I share this story because this woman did end up having an IUD after she delivered a wonderful baby girl, but she didn't stop there. As a leader, she took the information she had and used this as a model in her facility so that all nurses and health workers that were working there started to think in the context of the social context of how you can bring about change. She was a leader in and of herself and was leading this area, this facility, to make sure they could make the change and in turn teach other facilities to make the change. Nurses take the lead. demanding respectful care. As we all know, social norms are different, gender roles are different, they impact the type and the quality of healthcare that we see around the world. You know, when we talk about safe motherhood, we're not simply talking about the health of the woman and the health of the child when she delivers. It's not simply about preventing disability. It's more importantly about the rights of women, about the rights of dignity, about the rights of feeling, about the rights of choice. That's what's most important. And when we look at respectful care, there's been many studies about attitude, provider attitude. There's a nurse in Cambodia that works in a far-reaching facility, but she sees more children and more women than any of the other facilities that are very nearby that village. And what they learned as more providers went to see why she's bringing in so many people, they learned that it was her attitude, that it was the way in which she dealt with these women. And that becomes really important. Nurses are taking the lead everywhere in the world right now, ensuring that people get respective care, that people get the humanistic care they deserve. No matter their geographic location, no matter their cultural, no matter what happens. This nurse as well has taken responsibility to help Cambodia look at issues around humanistic, respectful care. Now, nurses are also taking the lead, and you know, when I have used this slide before, I've talked about examples from Tanzania or Kenya or the Philippines, but I'm actually going to give you an example from Liberia. There are 3 nurses in Liberia right now, Comfort, Nyaupu, and Varwo. These nurses are actually Japigo nurses, but they come from Liberia. These nurses were seeing that all maternal child health services have shut down in Liberia. And they decided, as leaders in their own right, after 5 years of working with these facilities, that they knew the communities the most. They went around all of Monrovia and began to work with health workers that were too afraid to go back to these clinics, too afraid to work with women and children. And what they started to do is teach them about infection prevention and the importance, because they have learned this themselves. They know all the aspects of infection prevention. They started to openly talk about Ebola. They took it upon themselves as leaders, as nurses, to ensure that we get these clinics back up and running. But they didn't stop there. They also know the communities. So they went out to the communities, particularly the Muslim communities, and began working with 100 Muslim leaders. And what they talked about was how they could do things differently during this epidemic. What were issues, the burial issues that you hear about in the news and all that. They spent a great deal of time with the Muslim leaders because they knew these nurses and were able to show them how things could be different, but these leaders had to take a stand and make a change. And in effect, these leaders then developed action plans. They're doing trainings in marketplaces for women's groups and the like. All of these are components of leadership. These are individuals that have knowledge, are making sure they share the knowledge, but are also learning from the community, are figuring out what works, are understanding the nuances so they can change and make this work for the future. That's true leadership. What also we know about nurses that are leading, they're elevating their profession. Everywhere I go in the world, I see nurses that are helping to mentor other nurses. I see nurses that are working side by side to ensure that they encourage people to go into a profession that is very challenging in this day and age, a profession that's a wonderful profession, but a very challenging profession. They're also always looking at ways to get better training for nurses and better ways to look at certification, which is really a new thing in many of these countries. But let's also look at some of the examples of nurses and doctor leaders that I've met over the time. Certainly when I look at Madagascar is a country that if you are a woman and you are going to deliver a baby in a breech position, you are going to have to go quite a distance, because those trained in emergency delivery are few and far between, and only doctors were allowed to do it. And so this woman is on an ox cart, and she will now travel 40 miles to be able to get to an individual that can deliver her. But the nurses decided in that country they needed to look at the issue of task sharing and task shifting. They worked side by side with the doctors to say, if we are trained, if we are empowered, we can provide this emergency service for pregnant women. And so the policies are changing, the standards are changing in Madagascar, and nurses and midwives are now allowed and taught and empowered to be able to do this. This took nursing leadership, but it took a team of nurses to work with a team of physicians to make this happen. A country that has limited nurses and limited physicians at that. And then you have Dr. Berry, and I'm using him purposefully because he's from Guinea, and he's a director of a maternity hospital in Farana in Guinea. I met him, and he's a remarkable man, and you hear so much about health workers right now in those areas. But let me tell you, there are incredible champions and health workers that are leaders of themselves. He learned a great deal about JPIGO's quality management system, how we help countries figure out their gaps in managing children's health and women's health, and then how they correct those gaps and measure themselves according to standards. He then decided he was going to work with 36 other hospitals and bring this knowledge to them. Didn't have to do it. One could argue he's too busy to begin with. They have huge numbers of women coming in. They have a maternal mortality rate in that country that's one of the highest. But he decided to do that because as a leader, he knew the importance of making sure that he elevated the profession and made sure that he shared what he knew and got others to do what he could. Nurses and doctors are also guiding new innovations. I think you all know that. All of you can think of examples whereby you have been involved in innovations. It's not simply technology, it's also policies, procedure, and the like. I've listed there a number of low-cost innovations that nurses and physician teams have worked on. It took their ideas, it took them understanding what the gaps were, and them being able to work through that discovery process. Quite often, it's the nurses and doctors in the field that absolutely know what can work and what can't. We always say an innovation is not successful if it's not adopted and available. It's not a great discovery if it can't be utilized by the health workers that are available in the country. Each of these, if you look at cervical cancer prevention using acetic acid and cryotherapy, it was a procedure that originally physicians developed, but they realized very quickly that nurses were on the front line and would see most of these women. And so country after country now, you're seeing standards and policies change where physicians are working side by side to ensure that nurses now are the primary screeners and treaters for women for preventing cervical cancer. There's many others with Laerdal helping mothers survive, helping babies breathe. These are two things that people you're even seeing in schools now at Hopkins and others. These are tools that were actually developed by physicians and midwives in these countries. The Helping Mothers Survive is a tool that is a simulator that can simulate normal birth and it can simulate bleeding after birth. And it's probably one of the best examples where now you're seeing schools and other centers, hospitals in developed countries tapping this because it's simple, it could be utilized by many different people, and it's really a way to really learn it without spending an enormous amount of money. And Laerdal Global Health was the one that helped that. So when we look at all these, you're all sitting there going, but the circumstances in Australia and New Zealand are different to some extent. But I would argue that even though the circumstances are different, there is similarity in how you manage success, how you look at sustainable leadership, how you look at elevating your profession. Each of these were individual examples of how people built leadership from within. And so when you look at managing for success, when you look at leadership, many people talk, because I've used this line quite often, when I look at leadership, when I look at my own leadership, I've always said, the best of leadership is when you build leaders around you. That is a true leader. Let me repeat that. A true leader is a leader that builds leaders around them. It's important to understand that it's really a matter of engaging with people and understanding what they're up to. It's really a model of understanding that we have to build sustainable leadership. And so in JPIGO, I have always said that the important thing that we must do is every person has a responsibility to mentor others. Every person has a responsibility to listen to others. And therefore, it expands out from there. And it's not just about building a healthy team and people working together. It's about making a difference in healthcare. You know, when we work and look at people in our countries, I always say that, quite honestly, they knew better than nuances. You can think about your communities in Australia and New Zealand. If you've moved facilities, if you've moved to different cities, there are cultural and social norms that are different. What we have to do is ensure that we're listening to the other people. We have to ensure that we're listening and getting advice and support. We have to ensure that we're listening because they have the institutional knowledge. I always say that, in fact, when you look across your health facilities in developing countries, there are common characteristics. Every individual plays a critical role, every member of the team. And therefore, if you understand that every member of the team plays a critical role, then you reach out and figure out how you get input, how you demand their involvement in developing solutions, so you're developing solutions together, how you demand a way to work together to, in turn, have better health care. One of our continuums of leadership that we talk about, as I said, is really building these leaders. And this is not just physicians or nurses or midwives. It's my finance staff. It's my HR staff. It is all people that see their responsibility as building leadership from within. What we're always looking at is looking for that next generation. You know, we need to continually think about how we are making sure that we are helping that next group. I want you to think about your units, how you define the leaders in your units. Usually that individual is somebody you want to follow. It's that individual that's tapping the potential of others. It's that individual that's willing to share and give of themselves so others can learn what they learned. It's always important that we try to look at leadership as a means for quality of care, as a means to make that difference, and as a means for the future. So oftentimes when you hear people talk about leadership, they're just talking about the teamwork and building together, and I would argue let's keep our focus on what our goals are. The goals are better health care. The goals are greater impact. And by building and accepting that it's okay if someone is going to exceed what I know. I have to accept that. I know as a CEO, all the way down to my staff that are in Tanzania, every one of us has to be working to bring people up beyond what we're capable of. Every day I say to my leaders, I'm helping you so that you will be me or beyond me. And so that goes on throughout our organization at all different levels. I encourage you to think in terms of who are your leaders and why are they your leaders? And I in turn look at that and say, the more that we can develop these leaders, the greater the impact we can have on the health care we're delivering. Think about it. You tap the potential of everyone in your departments. You listen to what their ideas are. You bring new ideas to the table. You put down the barriers to say, I'm the leader. And you allow these people to grow and know they can reach as high as they can. That's sustainable leadership, and that's going to build your organizations stronger and stronger. Teamwork, as you all know, and you hear about that, and obviously this conference has a big focus on teamwork. I would say that there are many components. I've listed just a few. Having a common purpose, effective leadership. I think effective and good communication and mutual respect are two things that we don't talk enough about. But what I will also say in traveling is I don't think there's one formula for teamwork. I think it is very different in different countries in which I work. I think as social norms are different and cultural norms are different, I see differences in how it's enacted. And so I think you have to be able to say that teamwork is going to look different in different ways, but there are unique variables that we have to look at, and communication and mutual respect are two things that we need to look at. So how do you make your impact? How do you look as leaders now at the future? Well, first, all of us have to demand the best possible care as advocates. All of us have to be leaders and encourage others to lead. All of us have to recognize the importance of all cadres. Whether you're a researcher, whether you're an implementer, whether you're a nurse in a facility or a nurse educator or a physician educator, every role is critical, and that mutual respect becomes a key ingredient to success and better health care for your people. Being the best advocate, I always say to nurses and physicians that I speak to, you got to negotiate your value. You know, if you don't ask, the answer is no. If you don't step forward, then you're going to be in the same place. It's a matter of being able, as a leader, to know your value and to talk about your value. You see, when you are able to do that, you're not only building up yourselves, but you're also building up your profession as leaders. And so I started out with photos about leaders. And I said to you, for each of them, they had their qualities. They had their qualities of what their mission was, what change they wanted to be in the world. I challenge you all to think about, what are you as far as a leader? What are your purpose? How do you engage others? How do you look at tapping the potential of others that you work with? How do you look at building that team that's unique and has unique characteristics to the setting you are? And then, how do you measure and look at that impact they are making by doing all of this? I encourage you to think about this. I encourage you to work on that. And so I ask all of you, I think we move forward as one, certainly as nurses and physician colleagues. This is our time to save lives, and we can save lives by elevating our profession, by sharing the information we have with others, and by building the legacy for the future. Thank you.